Hi there, Dr. Cary Yurkiw here. I'm a chiropractor in Kelowna. Today I'm going over intermediate stretches for the low back and the hips. And I'll show you what that means in one sec. So I'm just going to switch screens here and let's go over first the anatomy of the area. So what I'm talking about is the lower part of the spine and the hips right here, which includes the sacroiliac joints and the ball and socket joint in both hips. Now, the reason this area is so important is the nerves that come out of this area are very large and can travel a great distance. So the sciatic nerve can go right to the tips of your toes from this area. So if it's out of alignment, it can pinch those nerves, causing symptoms right in the lower part of the spine, the hip area, or traveling all the way down to the tips of the toes. So it's very important that we realign and do stretches to maintain the alignment in the area. The other thing that I'm going to show you here is the other part of the nervous system, which is called the autonomic nervous system. And these are sympathetic and parasympathetic nerves. They come out of the lower part of the spine, and the yellow nerves go to the bowels, bladder, the organs in the abdomen, and the green nerves go to the same organs, but one increases the tone, the other decreases the tone. So proper alignment and function of this area is very important for the tone of the organs as well as the muscles. So now let's talk about the best yoga poses for hips. So generally, what I'll give patients at the beginning is just simple yoga poses like the crescent lunge, putting one foot in front of the other, and then opening up the hips like this so it stretches out the hamstring, the quads. It works on the other leg by working on the stabilizers of the muscles on the front leg. So this is good for balance. It's also good for stretching and very good for posture. Now you can use a twist with this pose, and I would call that an intermediate stretch, where you're turning to one side in that position, and then when you're doing the other leg, you're rotating the other way when the legs are reversed. So that's a really good pose as well. I would hold this for 3 to 5 seconds, and I would do that about 8 to 10 times per side. I wouldn't do this one. I don't like this one, the awkward. The goddess, though, is very good for the hips. Just opening up the hips in a V position, squatting down, arms up overhead, holding that. That not only will stretch the hamstring and the buttock area, but it's also going to help to provide some strength and stability to the quad muscles right here to stabilize and hold you in that position, and to your spine and your upper back. Doing that position, I would hold for 3 to 5 seconds, do that 8 to 10 times. This one is an intermediate exercise as well. Crescent lunge with the forward bend. So basically front leg forward like the crescent lunge, back leg extended, making a neutral spine angle with the leg, so everything should be lined up, and the arms right up overhead, and just holding that position again 3 to 5 seconds, 8 to 10 times per leg. Happy baby, this is a beginner yoga exercise for the hips, so just bringing the feet back, opening up the hips, holding that. If you can reach your toes and the bottom of your feet, that's great. Just holding that for 3 to 5 seconds again, doing this 8 to 10 times. Side lunge, this is a little bit more difficult, and so is the garland. So these are more difficult because they require a fairly substantial knee bend and balance. I would call these advanced yoga exercises, so I would wait to do this one and the garland until you can do the other ones we've already discussed. And then the goddess twist, I like this one because what it does is it gets you down into this goddess position, and then bending forward and twisting to one side, and then holding for 3 to 5 seconds, and then twisting to the other side. It's an intermediate to advanced type of exercise that really works the hips and the lower part of the spine. And then the cradle baby, this one's good for the ball and socket joint. I would call it an intermediate exercise with one leg folded, the other leg up, and just turning that leg inward and holding that stretch towards your body. Again, 3 to 5 seconds, 8 to 10 times per leg. So these are the stretches that I like to give patients. that are more intermediate stretches. If you have any questions and you're a patient of mine, please feel free to ask at the next session. If you're not a patient of mine, you're looking for a chiropractor in your area, please comment below or DM me. I'd be happy to help. And always check with your health professional before you start something new, because you want to make sure it's appropriate for your condition.